Good morning, Trinity County. This is Ed Presley. I am the OES manager for the county, and I have a short update for you. The data that I'm going to be talking to you about at the beginning of this will be from California Health and Human Services Open Data Portal, and that can be found at https://data.chhs.ca.gov. California positives. There are currently 195,571 positives. That's an increase of 5,349 over the last 24 hours. Deaths in the state of California are at 5,733. That's an increase of 101 over the last 24 hours. Tests that have been conducted statewide are at 3.6 million. That's an increase of 101,446. That's a pretty good daily total, and I think that's what the governor was looking for. The hospital data is what we really track to find out how prevalent the coronavirus is changing our lives on a daily basis. Currently in the hospitals tested positive, there are 4,240 people. That's an increase of 145 over the last 24 hours. In the intensive care unit, there is 1,306 people. That's an increase of 38 over the last 24 hours. This second part of data comes from Johns Hopkins Coronavirus Resource Center website. And these are our neighboring counties and the positives that they have. Humboldt has 127 confirmed positives to date. That's an increase of 20 over the last 7 days. They also reported 4 deaths. Shasta County currently reports 96 positive cases to date. That's an increase of 45 over the last 7 days, with 4 reported deaths. Siskiyou County, they have a total of 26 reported cases, and that's an increase of 6 over the last 7 days. Mendocino County, they report 74 cases, and that is an increase of 27 over the last 7 days. Tehama County, they report 62 cases. That's an increase of 34 over the last 7 days, and they've also reported 1 death to date. Some will argue that the increases in the testing numbers, they're coming about, the positives are coming about because of the increase in the testing numbers. But, you know, I would just caution everyone to realize that those increases in testing numbers are really just an accurate view of what's already out there. And it's going to help us determine how to move forward through this pandemic. Let's please keep Trinity safe, and that's all my report. Marcy.
Thank you, Ed. Good morning, Marcy Jo Cutzel, Public Health Director, Trinity County. Our testing numbers to date are as follows: 748 total tests, 732 negative tests, 2 positives that have resolved. On June 24, 2020, as you are aware, Trinity County Public Health Branch received notification of a lab-confirmed positive case of COVID-19 in an asymptomatic individual. Because the individual is a resident of Humboldt County, but has been in Trinity County for the last 2 weeks, Humboldt County Public Health will monitor the case, and Trinity County Public Health will quarantine and monitor contacts in Trinity County. It can be very challenging to identify when a mask was worn by those positive individuals when in public in the course of the infective period, and how many places this individual or individuals visited while unmasked. Equally problematic are gatherings of many persons in close contact without face coverings that may have been exposed. We want to reiterate the importance of every Trinity County resident, every business owner, and every agency administrator adhere to the governor's mandate on face coverings and social distancing. Face covering and social distancing isn't politics, it's biology. The fundamental evolutionary paradigm of any biological being is survival and procreation. The SARS-CoV-2 virus is no exception. A vaccine will be critical in the development of community or herd immunity, in that too little is known regarding the level of antibodies to SARS-CoV-2 that may or may not confer immunities to subsequent infection and how long that immunity lasts. As Ed stated, he touched on the testing and the importance. The testing that we're doing is point-in-time testing. So sorry, excuse me. Is point-in-time testing, which identifies the active virus in a person at that point in time. Testing is going to be vital, ongoing testing, so that we can learn more about this virus. When serology tests become available, know more about the antibodies and the levels of immunity that they confer and how long they confer that immunity. Face covering and social distancing alters the environment to mimic the effects of herd immunity in the absence of a vaccine. We know that there are many questions about whether or not this virus has already circulated and infected sufficient numbers in Trinity County to confer herd immunity. This scenario is highly unlikely. This is due in part to the early implementation of stay-at-home orders and the unlikely sufficient introduction of the virus to Trinity County in the winter months of November through February. The other question is, why don't we let community or herd immunity occur through infection with SARS-CoV-2 virus naturally? Epidemiologists and biologists agree that this strategy does not bode well because of this virus's track record. This is essentially waiting for the virus to help us, and that is a very bad idea. Now that reopening has begun in many sectors, our public health goal is to try to the best of our ability to ensure not one Trinity County resident dies as a result of COVID. Please wear a face covering when out in public. Please maintain social distances of at least 6 feet. Please get your information from public health experts. Remember to wash your hands frequently and get tested. We have been and will continue to do this together, and I thank you so much for your time and attention. The health department's here to support you in any way we can. We'll be putting out information on different strategies for masking when people have difficulty wearing a cloth face covering for a variety of reasons. Thank you so much and stay well.